possible versus probable. It's difficult to discuss vehicle damage and occupant injury without discussing possible and probable causation and apportionment. A causal relationship between a trauma and an injury is defined as probable if the cause and effect relationship is greater than 50%, or more likely than not. There is a possible causal relationship between the alleged cause and an event when the likelihood is a causal relationship is equal to or less than 50%. A reasonable degree of medical probability or certainty, then, simply means that something is more likely to occur than not. Probability exceeds 50%. On the other hand, the probability of an event's occurrence equal to or less than 50% is just a possibility. Just because there was a collision does not mean that all the pain, symptoms, or tissue damage resulted from the impact. Whereas it's possible for injuries to occur from traffic collisions, the facts must be demonstrated that the possible is in fact probable. In some cases, there may be more than one cause of the symptoms, and apportionment is needed. Apportionment is simply a distribution of causation among multiple factors that caused or significantly contributed to the injury or disease and resulting impairment.